deeply engaged in and remains deeply engaged in Kashmiri community, actively contributing to KOA Healthcare Network and KOA Medical Advisory Group. He currently serves as a co-medical director of KOA, playing a key role in advancing healthcare initiatives with community. Before his clinical and leadership, beyond his clinical and leadership responsibility, he has supported several KOA programs, including Sponsor a Child and Education Assistance Program, reflecting his dedication to common services and global health outreach. Thank you, Vimarsh ji. Moving on to Dr. Rajiv Pandit ji. Rajiv ji is a board certified otolaryngologist, ENT specialist, who completed his medical school and residency in Chicago before establishing his practice in Dallas over 20 years ago. He specializes in head and neck oncology, sinus surgery, and voice disorders. In addition to his private practice, he serves in several leadership roles, including clinical instructor and chief of ENT section at Methodist Dallas Medical Center. Beyond his clinical practice, Dr. Pandit has been actively involved in global medical outreach. Since 2018, he has co-led medical and surgical mission trips to Amazonian region of Peru. His research contributions include several published journals articles in field of head and neck immunology. He is also a recognized expert in his field, has appeared on major news networks to discuss innovations in head and neck surgery. For over a decade, he has been consistently ranked as one of North Texas's top ENT doctors. Dr. Pandit was born in Srinagar and has been actively involved in KOA since its founding in 1982. He previously served as a zonal director and most recently spent several years as KOA's medical director, where he led the organizational medical team during COVID-19 pandemic crisis. He remains a key member of KOA Medical Advisory Team and will be spearheading the organization's new healthcare mentorship initiative. Thank you, Rajiv ji. The next one I have is, please welcome Dr. Sujata Ambardar. Sujata ji is a board certified infectious disease specialist who earned her medical degree from Temple University. She then completed her internal medicine residency at Washington Hospital Center, followed by fellowship in infectious diseases at George Washington University Hospital. Since 1998, Dr. Ambardar has been in private practice in Northern Virginia and serves as an attending physician in Anoa Fairfax Hospital. She's also actively involved in medical education, mentoring medical students and residents in internal medicine residency program. Dr. Ambardar was born in Srinagar and is a longtime member of KOA. Dr. Ambardar has been actively involved in Zone 4 community and has worked with KOA Healthcare Network for over 5 years. She currently serves as a KOA Healthcare Network Medical Advisory Group. During the COVID-19 pandemic, she worked tirelessly along other KOA physicians to supporting those affected both in US and India. Additionally, she plays a vital role in reviewing complex medical cases from India seeking financial assistance through our KOA alliance with Kashmiri Medical Emergency and Charitable Trust, KMECT. Welcome, three of you. Thank you for joining us. Those of you who are online, in case you have any questions, please do put them in Q&A. We will be reviewing them at the end of the presentation. Thank you. Vimarsh ji, to you.
Thank you, Ajay ji. Thank you. Thanks, everyone, for joining today's presentation. So we'll be discussing about Tchsaas, the Zukaam today, upper respiratory tract illness. And basically, we'll be talking about what upper respiratory tract illnesses are and what areas does it affect and how do you differentiate it from other serious illnesses like pneumonia. So when we talk about upper respiratory tract illnesses, we are mainly talking about infections which affect the nose, sinuses, pharynx, larynx, and the larger airways. And commonly, these infections are self-limiting, but they can lead to serious illnesses as well and some complications as well. We'll just focus on mostly viral infections, which are in these areas, and then how to differentiate with bacterial infections. What are the danger signs, and when should you seek medical help for these infections? What are the common treatment options, especially OTC medications, which can be used? And then how do you prepare for a clinical visit when you have to go and see your doctor? So in the upper respiratory tract infections, the common viruses which cause these infections, one of the most common, and we are seeing a lot of it this year, especially influenza A, we are seeing a lot of it this year. There's otherwise influenza B as well. Honestly, so far I have not even seen a single influenza B infection, but most of the upper respiratory tract infections and their complications, which I'm seeing these days, is because of influenza A infections. Most of the symptoms are related to, are mainly which are seen are like fever, cough, sore throat, body aches, fatigue, and malaise. Usually the illness is self-limiting. It lasts for about 3 to 7 days, but cough and fatigue may last, it may persist for weeks. Usually they are spread via droplets, and seasonally fall and winter season is the main time when it spreads. Then the next one is the COVID-19 infection. We are still seeing a lot of COVID as well, and there are spurts of it, which we are seeing at times. It's caused by the coronavirus. And the main symptoms are uh, either some sore throat, congestion, cough, which might be like mild symptoms, to some severe symptoms like fever, shortness of breath, loss of taste and smell, and then the patient might even become hypoxic and cyanotic as well. And in that case, the patient lands in the hospital. Most of the cases are mild and they resolve in 1 to 2 weeks, but then severe cases, like I mentioned, may require hospitalizations. Again, the spread is via droplets, aerosols. The virus size is much smaller, so the spread is it's much more contagious as compared to the influenza infection. Then the other virus which we see commonly is RSV, the respiratory syncytial virus. It's commonly seen in infants and children and then older adults as well. Symptoms could be like mild cold-like symptoms, runny nose, cough, sneezing, and it could be as severe as pneumonia and bronchiolitis in adults as well, especially in high-risk groups. Duration is, it usually lasts for about 1 to 2 weeks in most of the cases, and but may lead to complications in elderly or in immunocompromised patients. Again, it spreads via droplet infection, spreads via droplets and via contacted surfaces as well, fomite-borne surfaces as well. Then the other set of infections are, which we categorize as the common cold. These are caused by rhinoviruses, other coronaviruses. There are like more than 200 viruses which cause these symptoms. And the most common symptoms are like nasal congestion, runny nose, sore throat, sneezing, mild cough, and rarely fever in adults. Again, the usual duration is about a week to 10 days, though cough may linger longer from there. Again, it's a droplet infection and fomite-borne as well. So from contact, it also spreads. And we see a lot of it, like billions of cases annually for that. Now, what is the difference between a viral and a bacterial infection? Again, in upper respiratory tract infections, what we discussed so far was viral infections. Usually these symptoms are like self-limiting and may include like runny nose, cough, sore throat, and some mild fever. But in a viral infection, what happens is that there could be the sore throat could be much severe, like what we see in strep throat. Or there's a possibility that someone may have a viral infection and then they might get a bacterial superinfection and then they become sicker after that. In bacterial upper respiratory tract infections, the sore throatness is much severe and it may present relatively sudden as compared to viral infections, which are relatively subtle in the beginning. Again, it may come with high fevers, the lymph nodes might be swollen, and like I mentioned, that it may be as a secondary infection after an upper respiratory tract viral infection. Usually the doctor may do a rapid strep test or a rapid antigen test to differentiate between these infections. Again, in viral infections, we do not use any antibiotics. In fact, using antibiotics, it may cause resistance in the community. Then the lower respiratory tract infections. So far, we were discussing about the upper respiratory tract infections. In the lower respiratory tract infections, it could be a viral infection, but what is involved is the lower part of the respiratory system, the lungs, and may cause a pneumonia. It can be due to viruses like influenza or RSV. Usually, the symptoms are much severe, like severe cough, productive cough with phlegm. The patient might have shortness of breath, chest pain, high fever, fatigue, and sometimes even cyanosis, which means that the oxygen levels are low and the lung is not able to do its job properly. The diagnosis is often based on a chest X-ray or a CT scan. There are some blood tests which may help as well. And if it looks like a bacterial infection, the patient will definitely need antibiotics to treat this infection. How do we sort of differentiate between the infection being an upper respiratory tract versus a lower respiratory tract infection? The symptoms which the patient will have in the upper respiratory tract will be relatively milder, and it will affect mostly like nose, sinuses, pharynx, larynx, and larger airways. The patient may have a runny nose, congestion, sore throat, mild cough, sneezing. So it's mostly limited to upper airways, and usually these infections are self-limiting and only supportive care is needed. However, in the lower respiratory tract infections, it will affect the trachea, bronchi, lungs. So it's what we call as the pneumonia or bronchiolitis. And the infection is much more severe. The symptoms are much more severe as well. The patient may have severe cough. The shortness of breath is there as well, and much worse as well. The patient may have wheezing, chest pain, high fevers, and most of the times the patient may require medical intervention and might even need hospitalization, for example, oxygen or oxygen support and IV antibiotics in the hospital. There are some overlap in some of these viruses which cause lower respiratory tract infections as well. But again, with some testing, we can differentiate these infections most of the times. So for upper respiratory tract infections, what are the treatment options? Again, no antibiotics are needed for viral upper respiratory tract infections. In fact, no antibiotics should be used because that can make resistance in the community. Antiviral medications can be used. For example, for influenza, we can use Tamiflu, or there are a few other antivirals which can be used. Usually, these are only effective if the infection has started in the past 48 hours. But then, if people have some comorbid conditions or they are much sicker, it is still used in those cases as well. The other one is COVID-19. We are commonly using Paxlovid as for outpatient treatment for COVID-19 infection. When the patient gets admitted to the hospital, we commonly use remdesivir for that. And remdesivir is usually effective in cases where the infection has happened in the past 5 to 7 days. For RSV, there's no particular antiviral, but there are some which are used like ribavirin, and those are usually used in the hospital for severely immunocompromised or very sick patients. For bacterial infections, even if it is an upper respiratory tract bacterial infection, we may need to use antibiotics. For example, if it's a strep throat, we have to use antibiotic for that. And then, we should always finish the course of the antibiotic and not use, not stop it within, at a shorter course. But again, we should avoid antibiotics in viral infections to prevent resistance and side effects. So what are the over-the-counter medications which can be used? And mostly we have to manage the symptoms for these viral infections, the upper respiratory tract viral infections. And one of the most common ones are decongestants or antihistamines which are used. Decongestants, what they do is that they relieve nasal congestion, like they are, for example, pseudoephedrine or phenylephrine, which are used. and they are available over the counter as an outpatient, uh, over the counter. There are some serious side effects, so we need to be careful about them. They can cause increase in blood pressure. It can cause insomnia, nervousness, and we should avoid it in patients who are like less than 4 years old, or in elderly patients, or especially patients who have heart conditions. Then antihistamines are very commonly used, like diphenhydramine, which is commonly called as Benadryl, and then others like loratadine can be used as well. What they do is that they reduce runny nose, sneezing, and some minor allergy effects which are there. The side effect is that they cause drowsiness, especially the first generation ones like Benadryl. They can also cause dry mouth and dizziness, and again, they need to be avoided in children who are less than 4 years old, or in elderly people. Then the other set of medicines which are used are called as cough suppressants, and one of the common ones is dextromethorphan. What that does is that it reduces the cough in such people. The side effects are again like drowsiness, nausea. There are some other rare serious side effects in kids as well, so we should avoid it in less than 4 years age kids. Then the other over-the-counter medications which are used are expectorants like guaifenesin, commonly also called as Mucinex here. What it does is that it loosens the mucus in productive cough. It's relatively mild, but there are some side effects like nausea, headache, and some rare allergic reactions. One of the things which I personally like a lot, and I have a picture of it on the right side, the green one, and it's available over the counter, and it's called as acapella. What it does is that you have to blow into it, and it makes the upper airways vibrate, and all that cough, which the phlegm which is in there, it becomes easier to expectorate that phlegm. So that's something which I always recommend people who have who have cough and congestion, and they feel that they're not able to cough up their phlegm. And then on the other side, for pain and fever, we can use Tylenol, which is acetaminophen, or ibuprofen, which is Advil. It helps with body aches, fever, sore throat, but then you have to be careful about um, overdosing on Tylenol, because a lot of medications has acetaminophen in it. So we have to be careful how much Tylenol we are getting in a day. Otherwise, it can cause liver damage and other side effects as well. Ibuprofen is an NSAID, so you have to be careful that it should not be used too much, because it can cause gastritis and stomach irritation, and then it increases the risk of bleeding as well. Again, be very careful with all these OTC medications, especially in young kids which are less than 4 years old, because of their side effects. And you should always consult a physician for these groups. So, what are the other comorbid illnesses which can make the upper respiratory tract infections worse? So, people who have asthma, COPD, they're at a higher risk of having side effects. People who have heart disease, that can be exacerbated by these infections, and heart failure and other problems can happen, like myocarditis, and there's an increased risk for hospitalizations for those patients. Diabetics have a weakened immune response, so they are at a higher risk as well. Then there are other patients like immunocompromised patients, people who have HIV, who are on chemotherapy, chronic steroid use. All these patients are at a higher risk of infections spreading and becoming more of a lower respiratory tract infection as well, and they can get hospitalized because of that. Elderly adults also have a reduced immunity, and we've seen severe outcomes because of these infections as well. The only prevention for these viral infections, mainly the flu, COVID-19, and some who are eligible for RSV infections, is vaccination. And then the other thing is to manage your other chronic conditions properly. So, what are the danger signs, and when do you see a doctor? So, if all these symptoms they last more than about a week or 2 weeks, or if even after 5 to 7 days, the symptoms are getting worse, you should definitely contact a doctor. People who are at high risk, like elderly, infants, immunocompromised, or those with some chronic conditions like we discussed earlier, I think you should be in touch with your doctor and make sure that the disease is not getting worse. Uh, and then in children, especially if there's high fever, labored breathing, or if the symptoms are getting worse, you should definitely talk to the doctor as well. Now, there are some danger signs which you should be knowing right from day one. So sometimes the disease can progress very quickly, and it doesn't give you like 5 to 7 days um, to wait and watch for the worsening. So if you have difficulty breathing, shortness of breath, persistent high fever, which is not breaking even because of the medications, especially fever which is lasting more than 3 days, any chest pain or pressure, bluish lips or face, which means that you might have lower oxygen numbers, severe cough, especially with blood in it, or yellow and green thick phlegm coming out. Also, mental status changes or neurological weaknesses, or even if the symptoms are worsening very quickly and you think that the infection might be progressing to a lower respiratory tract infection, you rather than going to the clinic, you should go to the urgent care or the emergency room at that time. So if you end up going to the doctor, what does the doctor want to know from you? So the doctor will ask you about onset and duration and progression of the symptoms. That will sort of allow them to differentiate between these different viruses. And then there are some specific symptoms like fever, cough, congestion, sore throat, which they want to know. What is your exposure history? So, for example, if you've been in an area where COVID-19 was more, um, the risk of having COVID-19 as the infectious vector is higher, then what is your medical history? If you have other immunocompromised states or diabetes or asthma, that also puts you at a higher risk. So the doctor will want to know those things as well. Also, what all medications and allergies you have, because if the physician has to give you some medication, they want to make sure that it is not interfering with other medications. So on your side, you should keep a symptom diary and uh, keep all notes of exposure, travel, and have a list of your medications, list of your chronic conditions. This will help you prepare for your doctor visit. The doctor should do a detailed physical examination, look at your throat, ears, lungs, and based on that, they may order some tests as well, and that will help them determine the next steps. Again, the only way to prevent these things is by vaccination, and Sujata ji will discuss it in more detail as well. Definitely, practicing hygiene is going to help a lot. Hand washing, frequent hand washing, covering your cough and sneeze, avoiding sick contacts, keeping the surfaces clean, that is going to help. Masking is going to help, especially if there's an outbreak. And then, if you're sick, uh, stay home if you think that, that if you think that you can stay home so that you don't spread it at other places as well. So the key takeaways from my presentation is basically the upper respiratory tract infections are mainly caused by influenza, COVID-19, RSV, and some other common cold viruses. What you need to do is that in your mind differentiate between viral and bacterial infections and monitor for the pneumonia and complications, recognize the danger signs and seek medical help promptly if needed. You can use some OTC medications, but be cautious if you have some comorbid condition, or if you think the OTC medication can cause side effects, so consult your doctor for that. And take your vaccines, and when you go to your doctor, be clear on the history and symptom tracking, keep your notes with you, and stay informed, get vaccinated, and practice good hygiene, and that is going to help us spread the disease. Thank you. I am going to hand it over to Dr. Rajiv Pandit. Rajiv ji, I'm going to hand it over to you, and I'm giving you the control as well.
Rajiv,
Rajiv,
you may be
you
speaking on
might be,
mute.
you might be on mute.
Can you hear me now?
Yes.
Thank you, Vimarshi. Vimarshi spoke as an internal medicine physician, so very comprehensive. I'll be focusing from an ear, nose, and throat or otolaryngology perspective. So I'm going to get a little bit more narrow and a little bit more focused. Some of it will repeat what Vimarshi covered. And then we're also going to see if you're awake. We're going to do a little bit of Q&A. So get ready to answer some questions to see what you retained from his talk so far. So I'm going to go back to the beginning of my talk here. So if you've ever wondered what is the difference between a virus and a bacteria, or why don't we have a vaccine for the common cold, or are there antibiotics to treat the cold or COVID, then you come to the right place. And actually, Vimarshi answered most of these questions, if not all of them. So we'll see, like I said, if you've been paying attention. So this is the first question for all of you to answer. What is the most common way that upper respiratory infections are spread? Is it A, sharing food or drinks, B, direct contact with sick individuals, or C, respiratory droplets from coughing or sneezing? Do we have the poll ready to go?
Yes, Rajivji.
Okay. So all of you, please answer. And then we'll just wait about 5-10 seconds. And then if Aparche, if you could just tell me what the top answer is, then I'll continue.
Yeah, almost 50% have submitted. So let's just give 30 more seconds and we can end the poll.
Okay, what do you have?
Okay, so I think you should be able to see the result.
Perfect.
So looks like, the last option is the
Archie, people were paying attention to your talk. Great. All right, let's go on. Respiratory droplets is the correct answer. All right. All right. So as was discussed, what is a URI, upper respiratory infection? As you can see from the left side, upper is anything above the throat. But what exactly is the throat? I have a lot of people coming to me say they have a problem with their throat. But for me, throat is a very big area. The throat can be the back of the nose, the back of the mouth, or down by the voice box down over here. All of that is the throat. So in front, we call it the nasal cavity. Through the mouth, the back is the pharynx, and down below by the voice box is the larynx. All of that is the upper respiratory area, upper respiratory tract. The lower starts with the trachea down here, or what's commonly known as the windpipe. And when it splits into the lungs, that's all lower respiratory infection. So anything that gets into the lower respiratory tract is generally more serious. So the two things that I'm going to just cover are common cold and influenza, although I do cover sinusitis, rhinitis, pharyngitis, laryngitis, and otitis. Those are all areas: sinuses, nose, throat, voice box, ears, all are areas of the upper respiratory tract. So the common cold and influenza are very, very similar in terms of how they present with symptoms. They're both viruses, and the symptoms usually appear a couple of days after the infection with the virus. So for a cold, sore throat, runny nose, muscle aches, dry cough, headache, fatigue, fever. Usually it's a low-grade fever for a cold, if you have a fever at all. But for a flu, it can get to be more of a higher fever. And the flu, this is for flu, you can see very similar: fever, cough, sore throat, runny, stuffy nose, muscle or body aches, headaches, and fatigue. For the flu, you generally have more generalized symptoms, and it'll include more likely muscle and body aches more than you usually see with a cold. But the issue with a cold with a flu is that it can lead to secondary infections. So a secondary infection would be, for example, you have the flu and then you develop sinus pressure and you may have a sinus infection. You may have the flu and then you may develop a lung infection, a pneumonia. So when it gets complicated and you have a secondary infection, at that point you may need further treatment. And the complications here are sinusitis, bronchitis, pneumonia. It can even trigger asthma or ear infections. So next question. So get all of your responses ready. Which of these is not a recommended treatment for a URI? Taking antibiotics, rest and hydration, over-the-counter medications. We're going to do this one very quickly, just 10 seconds here. Okay, what do you have? Yes. All right. Everyone is paying attention. 2 for 2. Let's go to the next slide. Okay, so viruses and bacteria. Vimarsh covered those. I'm going to cover those a little bit more in more graphic detail here. So viruses are responsible for the infections on the left. Bacteria is responsible for in the ENT area for things such as usually a strep throat. Strep throat is a bacteria infection. A lot of sore throats can be viral, but when you get a test and it's positive for strep, that's a bacterial infection. So for a normal throat, you'll see, well, let's go to the virus one on the right here. If you look for someone who has a sore throat and they have a viral infection, you probably may not see much, maybe a little bit of redness. But with a bacterial infection, you're going to see usually spots on the tonsil. You're going to see it's going to look more inflamed. It's going to be more painful. And usually what we call an exudate or a coating on the tonsil. And that's usually a sign of a bacterial infection, which can be confirmed with a strep test. So the big difference between a bacteria and a virus is that a bacteria is alive. What that means is that a bacteria can split, it can spread, it can survive on its own. A virus, on the other hand, cannot survive on its own. A virus needs a host, usually a human being in our case, and a virus can only survive for 5 hours in a hard surface outside of the body. So viruses cannot be treated with an antibiotic because an antibiotic works on the wall, for example, of the bacteria. So it'll destroy the wall of the bacteria. That's one way antibiotics work. Whereas viruses really don't have a wall. They're kind of just genetic information enclosed in protein that invade cells. So they work very differently and they're much harder to control. And in fact, antiviral medication came out much after antibiotic medication because it required a lot more understanding of immunology to deal with viruses. Fortunately, most viruses aren't as serious as bacterial infection, but they can be, such as with influenza or with COVID in some people. So can antibiotics cure colds or the flu? We're going to skip this question because I think everyone should get this one right. Antibiotics cannot cure the cold or flu because they're viral. And so the answer would be no. So we're going to go to the next slide here. This is a good one. Does cold weather itself make you sick? Yes or no? Can you get sick by being exposed to cold weather? Okay. The answer is no, but it's also yes. It's actually both. So cold weather itself cannot make you sick because cold weather is not an infectious agent. It is not a virus or a bacteria. But cold weather can lower your immune system. So if your immune system is lowered and you are exposed to a virus or bacteria, then you are more likely to get sick. So your parents were right when they said, don't go out in cold with wet hair, or don't go out and be exposed to other people when you're feeling cold because your immune system will drop. But there are no viruses or bacteria around and you're cold, you will not get sick. All right. So the main thing to keep in mind is that prevention measures work. They really do work. Vaccines work, personal hygiene practices work, respiratory safety measures. What that means is, covering your mouth, wearing a mask, using an air purifier, opening the windows, using hand sanitizer. All these things have worked. And in fact, people during COVID have gotten much, after the COVID pandemic, have become much more aware of this. And there are a number of patients I've talked to where the patient may be sick, but we're able to contain it so that no one else in the family gets sick because people are now more aware of how to prevent this even in the same household. So one thing that's very important is that we know from data from COVID that a cough and especially a sneeze can travel 6 to 12 feet. So it's very important to cover your cough and sneezing into your elbow, turning away, coughing to the ground are all ways that you can prevent other people from getting sick. Hand hygiene is very important. Most of us, many of us, wash our hands or use hand sanitizer for far too short of a time. At least 20 seconds of rubbing your hands with hand sanitizer or with soap is important and critical to cut 99% of the infectious material. Well-ventilated spaces are very, very important as well. If you work in an office space where you're close to other people and you don't have good ventilation, you're more likely to pass around infections. So even a fan will help. If people are sick around you, wearing a mask will help. And these things can do a lot to prevent infection. When wearing a mask, it's important. I see people wearing a mask and it'll be very loose. It'll be hanging over here. It'll be covering the mouth, but not the nose. You have to wear it right. You have to cover the nose. You have to cover the mouth. You have to press on the nose to make sure that it's actually sealed. And if you are coughing quite a bit, or if you're have a fever, it's important to wear an N95 mask. An N95 mask provides a much better seal and is more likely to prevent spread of bacteria when you are coughing or sneezing. Next question. Does vitamin C prevent colds? Yes or no? Or no, but reduces the duration?
This is a tricky one, Rajivji.
Yeah, they're going to get more complicated. So what do we have?
It's a tie.
Yes, no, but reduces the duration. So the data that's out there, the quality data, shows that vitamin C does not prevent colds, but it reduces the duration by about 2 days if you take it in the first 24 to 48 hours. So the bottom line is taking vitamin C helps your immune system, and it also helps your skin. It's an antioxidant. Vitamin C is one of the few holistic or alternative medicine or non-prescription medications that have been shown in multiple research studies to be effective. I take 500 milligrams twice a day. That's a reasonable dose. Some people take a higher dose, but then you can have GI upset. At 500 milligrams twice a day, you can prevent getting sick, and you can prevent your immune system. You can boost your immune system as well as your skin and collagen. So the answer technically is no, but it reduces the duration. All right. One of the things that I'm a big proponent of in my practice, even though my practice focuses quite a bit on surgical treatment options for people that have severe and long-term problems, is steam inhalation. Multiple studies have shown that steam is very effective in decreasing the viral load and rendering inactivating viruses. So when you do steam inhalation, you are actually improving your health. At that moment in time, you are inactivating the virus particles that are in the upper respiratory tract. This does not necessarily work for the lower respiratory tract as effectively, but definitely for the upper respiratory tract. But what it can do is it can also allow you to expectorate or clear your lungs by taking in warm, moist air. When you gargle, you cannot get air down into your voice box. The only way to get hot, moist air down into your throat and into your trachea and into your sinuses is through steam. These are two models that have been effective and are endorsed by ENT doctors. They're both VIX models. One is a handheld model that you can watch TV with. You can move around a little bit. The other is more of a desktop model that's safer for kids. It has a more stable base, but both are VIX steam inhalation, VIX steam inhalers. That's all I have. Thank you.
Okay. Hello, namaskar. Hopefully everybody is still awake. And thank you for being patient, and thank you Vimarshji and Rajivji, who covered a lot of material. So basically, some of this will be repeating things, but just wanted to first talk about
giving control to you.
Okay, thank you Vimarshji. So just as you've already heard, that the respiratory season is pretty significant this year, and I have only 10 minutes, so it's fine. I can probably talk in 10 minutes, but it's actually the worst flu season since 2009. So it's a 16 year all-time high in terms of influenza A across the country. And we're definitely seeing significant influenza activity in our county, all over the US, and it's led to increased hospitalizations for pediatrics, adults, immunocompromised. So this is a viral illness, as we all know, as Vimarsh and Rajiv described. COVID has been more stable, not so much. RSV is declining currently, but is also a problem. Some of the other viruses that were not mentioned include human metapneumovirus, adenovirus, parainfluenza, and rhinovirus. Many of these viruses can be checked with testing that's available. So this is a graph which shows the influenza positive tests that we've had, and it's been at an all-time high. And the higher the percentage in the ER that test positive in respiratory illness, the higher the influenza rate usually is. And as I said, it's at an all-time high. So what are symptoms of flu? And I'm not going to repeat some of this we've talked about. Flu, especially influenza, it usually presents with more severe symptoms than a cold. And that's intuitive. So it'd be fever, chills, body aches, cough, headache, and in addition to congestion. We talked about this. Usually flu is more severe, it's abrupt, people are sicker, and there's more risk for progression into hospitalization, whereas cold is milder symptoms and most people can stay home for that. I'm going to focus a little bit on, I think Rajiv talked about hand hygiene, etc., washing your hands carefully, and transmission of infection through respiratory droplets. One of the things I did want to mention is that although we've talked a lot about influenza, COVID is still a big problem. These are the COVID vaccines that are approved for the season, the Moderna, Pfizer, which are the typical mRNA vaccines, but then there's one called Novavax, which is a protein subunit vaccine in case people can't take mRNA vaccines. They're all three efficacious and all FDA approved. The recommendation is that if you haven't had a COVID vaccine for 2024, 2025, that you do get it, especially if you're immunocompromised or high risk. Regarding flu vaccine, since we said this is one of the main things that is preventable, the flu vaccine generally has three components to it. It has the A component, the B, and then it also has, it has two types of A. One, the H1N1, H3N2, then it has a type B. So this year there's three components to the vaccine. And just so you know, people get worried. They think, oh, if I get the flu vaccine, I'll get flu. It's not a live vaccine, it's inactivated. You shouldn't get the flu. And as Rajiv and Vimarsh mentioned, although there is sometimes bad press about vaccination, flu vaccine prevents thousands of hospitalizations and deaths every year. So a very important vaccine to get. So these are the three main vaccines for people over 65. So there's the general flu vaccine, but for people over 65, they have a high dose flu vaccine. They also have one that's an adjuvant flu vaccine, which is like the high dose. The last one is one that is for people that have a severe egg allergy. So most of flu vaccines are made from cell culture, but this is a recombinant. It doesn't involve any cell culture. So that would be, but you would have to have a severe egg allergy for that. So in terms of RSV vaccine, CDC recommends the RSV vaccine for all adults over age 75 and older, and for people between 60 and 74 who are at increased risk for RSV. And it's the common theme that has been said. So people that have high risk would include chronic lung disease, chronic heart disease, weakened immune system, and some other medical conditions, including diabetes, obesity, and nursing home residents and other people that are immunocompromised. So the RSV vaccines, there are 3 that are FDA approved. As of now, they're just recommending you get 1 vaccine, and there's no need to get a booster for now, because the recommendation is only 1 for now. And then just to remind you that in addition to the viruses that we have, influenza and influenza A, B, the rhinovirus, there have been all these things happening, including there's a big surge of whooping cough or pertussis in the last year. So they're recommending you get vaccinated with tetanus, diphtheria, pertussis. Every 10 years is recommended. In pregnancy, they recommend with each pregnancy. Mycoplasma was another problem this year. It's the walking pneumonia. There's been an increased prevalence in communities, including our local area. And then, of course, there are pneumococcal vaccines. Please stay up to date in terms of that, especially for those over 65 and those that are immunocompromised. So just a summary, and thank you very much. And we want to have time for some questions and also for some message we wanted to also talk about donations. Thank you. Vimarsh, please.
Thank you, Sujata ji. Thank you, Rajiv ji. So we'll take some questions as well, but I have some other things which I want to share. We have a request for the community. So what we are doing today is we are launching a campaign from KOA. We are calling it Save a Life campaign. And over the years, what we have done is we've been helping a lot of patients in India with their illnesses, especially people who are not able to afford their treatment in India. I have some examples. For example, there was a 62-year-old man who was admitted to the ICU with ruptured vertebral aneurysm and required neurosurgery, ICU support, a lot of serious procedures like coiling, and then later on he was referred for rehab as well. What we do is we partner with an agency in India called as KMECT, and what KMECT does is that they help to gather all the details about the patient, and together what we do is that KMECT helps with some funds for those patients, and then we also contribute. And what we do is that we don't pay the patient directly. The money goes to either the hospital or to the treatment center. For this gentleman, we paid them about $4,500. This was this year, January. Then there was another one another patient which we took care of this year. This was in February this year, and this was a 68-year-old man with shortness of breath and had severe aortic stenosis and mitral regurg, and he required aortic valve replacement and mitral valve replacement. He had a prolonged ICU stay, and he had a lot of complications with sepsis, renal failure as well. Again, the patient's details were verified by KMECT. KMECT helped the patient as well. And then from our side, we disbursed about $4,500 as well. This was just last month. So over the years, we've been taking care of a lot of such patients. And all this only happens because people donate to our KOA Medical Fund. Over the years, you can see this is a graph from 21 to 24. Last year, we donated about $81,000 to patients who were in India for these kinds of cases. There's a lot of oncology cases, a lot of severe illnesses which we are seeing. And now we have one more case in front of us where there's a young girl who has metastatic cancer. This is a recurrence of her cancer. I believe we had sent her some money earlier as well when initially the cancer was diagnosed, but now she has a recurrence of this cancer. At that time, we had given her about $6,000. Again, all the details were verified by KMECT, and KMECT also did some of the fundraising for that girl as well. Unfortunately, the cancer has relapsed now, and the only treatment which is left for her is a set of injections. And I believe she needs about 6 or 7 injections, We have collected some money, which we are going to disburse, about 2.5 lakhs, which is about $3,000, which we are going to send her this month. But then she will need coverage for 4 more shots, which is about $11,000. So what we are trying to do is that we are trying to collect money for these patients, these cases in India, and we would want help from people who can donate for these causes as well. These are those patients who have exhausted all other resources in India. Other agencies are also helping them, for example, KMECT. And if you donate to this fund, 100% of this money goes directly for care for those patients. I personally only donate to Kashmiri causes. I don't donate to other causes. And one of the big reasons is because I want to see every single penny of my dollar being used for treatment for the patient. And that's what happens in this case. In 2024, 2025, we are starting this campaign, Save a Life campaign. In 24, we raised we donated more than 80,000. We donated $81,000. And this year for this campaign, the goal is to raise at least $50,000. And we need your support for that. I have a QR code over here as well, and you can scan that. And there's some PayPal links as well, where you can go and donate. If you want to go to the KOA USA website and donate over there, you can go and donate over there as well. You can donate a very small amount. We don't need a huge amount for donations. It's small amounts which will add up and which will help these people out. We do have some testimonials from patients who we have helped, patients and their family members who we have helped in the past as well. And we do share them on various occasions with everyone as well. So thank you. Thanks a lot, everyone.
Thank you. Thank you so much, Vimarsh. And just a quick comment. I mean, we're now looking at these, getting to see some of these cases up close. And, the cases that come to us are typically extremely complex, extremely capital intensive. And, it's sort of a life and death kind of a situation for many of them. And these families most likely have vanished their life savings. So it's like, they're coming to us as a last resort. So, and it's very hard to sort of, refuse or decline the help. And so, and we can only do so much. So that's why it's extremely important for the broader community to support these critical cases. With that, I know we are coming just about time, but let's quickly open for Q&A. I think there is a question here. Rajiv ji, would you want to touch upon that, the neti pot question?
Yes, the neti pot. That's a great question. So of course I approve it because it's actually the neti pot, right? It's from the Sanskrit word neti, to follow or to lead. And it's you go back to Ayurveda, Hatha Yoga, you'll hear about gel neti. So it was actually, the product was actually created by a pulmonologist, Dr. I think Kiran Mehta was his name. He named it after, the company's named after his son Neil. So it's called Neil Med. But it's an Ayurvedic technique that he took and made a multi-million-dollar business out of in 2000. I wish I had thought of that. Any other questions?
Thank you, Rajiv ji. Vimarsh ji, you can stop sharing if that's okay.
Sure.
I mean, if anybody wants to ask a question, you can type it in the Q&A chat, or you can raise your hands and I can enable talking for you. I mean, I do have a question in the meantime. Like typically Tchsaas, Zukaam, Tchsaas, and a lot of times if it gets worse, chalo ji give antibiotic. I mean, at least India mein aisa hi hota tha, like, you would take antibiotics for any situation. So can you touch upon like, can it be having a negative impact if we do that without thinking through, hey, if it's a bacterial or a viral, or, it doesn't really have much of an impact if it's a viral. So that's about it.
So Uphaar ji, I can talk about that because that falls into the whole area of overuse of antibiotics. So, I mean, this is basically, we're trying to make it so that people understand about viruses, but one of the reasons that both Vimarsh ji and Rajiv ji emphasized don't take antibiotics for viruses is because if we all took antibiotics, first of all, there's side effects to antibiotics. You can affect the stomach, and people can get, there's something called C. diff, which can cause diarrhea and can cause colitis in the stomach, can change the flora, and also you can drive resistance. So the answer is yes, there are bad consequences.
They
Got it.
actually also destroy normal healthy bacteria. So they can be counterproductive. And one of the reasons why we have super infections, right, which Sujata knows more about, is because of the overuse of antibiotics. Now we have bugs that cannot be treated with antibiotics.
I do have a question too, for you, three of you, probably one of you can answer is, they also talk about gargling a lot when you have a upper respiratory tract infection. Does that really help? The saltwater gargles?
Yes, gargling helps because it actually helps. The same reason neti pot helps, same reason that sinus irrigation helps. It helps loosen the mucus. It helps. It's like a shower. It flushes out. The not only the not necessarily the bacteria or virus, but it flushes out the body's immune system tries to stop the infection. So in the mucus you have your immune cells, and you have the byproducts of this battle between your body and this infectious agent. So by clearing that mucus and allowing the cilia that are moving, which are tiny hairs that clear the area, you're allowing your passages, your immune system to work better by clearing all that mucus. One of the other thing that we can maybe get into on another talk where we look at more of our holistic and Ayurvedic upbringing is how much now that is being not only with Netipad but vibrations. Multiple studies now show that chanting and yoga actually physiologically improves our immune system by releasing a gas in the sinuses called nitric oxide. So when you say Om, you're actually releasing nitric oxide in the mucus lining of your sinuses. And then nitric oxide is antimicrobial. It's antiviral, antifungal, and antibacterial. So chanting and vibrating and breathing in and out through your sinuses, now Western studies have shown actually helps your immune system. So there's a lot of interesting things coming out that support what we have known for thousands of years.
Awesome. So there is this question. Varji, are you going to call that out? So this question and
You can go ahead, Ajay.
so there's a question specifically for you, Rajiv ji, is I have a deviated septum. One of my nostril is always blocked. Would septoplasty help?
Yes, it can help. You obviously need to see an ENT, get a CAT scan, most likely, or a nasal endoscopy, which is a camera of the nose. But a septoplasty is a simple 45-minute outpatient operation that can do wonders for breathing better.
You and then one more question is a question out there is there any role of labs, aka CBC, in URI?
Sujata ji, want to answer that?
I can, or Vimarsh, it's fine. I mean, I go ahead, Vimarsh. I'll let him.
Yeah. So, I mean, as such, if the symptoms are just following the normal trajectory, there's no role initially. But if things are not improving, then there is a role, because then we have to make sure that it's not a bacterial infection and few other things we can find out from CBC as well. So yes, in the later part of the disease, if things are not improving, but initially, if the disease is just going through a normal trajectory, there's no role for getting a CBC. Sujata ji, you have something to add?
Yeah, I was just going to add that, the thing nowadays is that there are a lot of rapid tests. We actually, even in our office, have a rapid viral test. And this was actually 2 cases. I mean, this was surprising because usually it's hard. We don't make diagnosis. So one of the questions was what happens when nothing works? And that's my patient. I usually get patients that you don't know anything to do and you order lots of tests. But anyway, this was a patient who luckily it was somebody we knew. She came and she didn't know what was going on and congestion. Then I said, well, let me just do a rapid viral test. She ended up having influenza B. So at least we had a diagnosis. There's nothing, she had it probably for weeks, but at least she had a diagnosis. So sometimes that will be helpful to look for viral pathogens. It's not something you would do on everybody, but there are. But some of the blood work we do later on, because it won't really give us a diagnosis. It would be more for somebody who's getting sicker.
Going back to what Vimarsh said earlier, it's very important when you go in to be organized in how you give the information so that the doctor can then determine if a test is needed or not. If you can come in and mention how long you've had it, when symptoms started, if they've been getting worse or better, basic information organized. So going in with, I love patients that come in that have like a sticky and have it organized, because that can help us determine what tests to do. And a lot of times patients will come in and say, I'm sick, I need a blood test. And then you spend the whole visit explaining to them why you don't need it, and then you don't really get to the actual information you need.
Thank you, three of you.
I-
There's another question out there. Oh, sorry, go ahead,
I
Uphaar.
was just going to say, I'll add one more thing here, and this is about mycoplasma. Most of the patients who I see is like who get sicker and land in the hospital, and this helps me as well. If the patient has just started an illness like 2 days back, we are less aggressive for that patient. But then if the patient has been sick for a week or so, we are seeing a lot of super added bacterial infections, especially mycoplasma infection nowadays as well. And then those patients need antibiotics, and they actually they get cured very quickly as well. So a good history of the trajectory of the disease for us, it helps us a lot.
Thank you so much. Another question out there is, do we have any data on long-term effects of COVID vaccine that we took during pandemic?
Yeah, I don't know what to say about that. I think that the only thing that has been shown is that when the vaccines came out, there was a subset of people, young men, and there was an article published on that may have had a slight increased risk of myocarditis. But beyond that, which was a very slight risk, and even in that, the benefit of the vaccine outweighed the risk, there's nothing else that I know of that has been proven, other than some minor things. But maybe Rajiv or Vimarsh, do you guys have anything to say?
There's no good study. I think a lot of it has been there are some issues, but they're extremely rare. And a lot of those rare situations have been overstated in the media because of just the way media is, right? So if you have one plane explosion or one plane disaster, you're still much safer taking a plane than a car, but people will avoid a plane. So we just have to realize how news media can impact us. But statistically speaking, Sujata ji is completely correct. There is no data to support any significant issues with the vaccines. They're completely safe for the vast majority of people.
Thank you so much. I think we have a last question here. What is the difference between hay fever, common cold, and flu? How can we differentiate them at home?
So hay fever is generally just a generic term for, it has nothing to do with hay, but it was, I guess, hay cutting season. So it's more of like fall season where it's more ragweed and other things that people have allergies to. But hay fever generally is indicative of allergies. It can be difficult to distinguish between allergies and a cold, especially in the first 2 or 3 days. So generally with allergies, if you've had problems in September every year and you're getting those symptoms again, so it's good to become self-aware and know your body, then it's probably going to be ragweed. But if it's if it comes on differently than at other times, or it's lasting for you're getting muscle aches with it, which you don't usually get with hay fever, then it may be something else. So it's important to keep going back to what I said earlier. It's important to keep those symptoms noted, understand your body, understand your pattern, and go to a doctor if you don't get better with over-the-counter medication. If anything that lasts over 7 days, I tell people to definitely contact a doctor.
Thank you so much, Rajivji. Uphaar ji, back to you. Do you like to close? this session?
I think this was, I learned a lot. So thank you so much, Dr. Rajiv, Dr. Sujata, and Dr. Vimarsh for taking out time conducting the session. Thank you, everybody who could join us today. By the way, just to close, I love the topic, Tchsaas to Zukaam. I know, whosoever suggested that, deserves an award. So looking forward for more creative topics for our upcoming sessions. Thank you so much, everybody.
And I think we will be sharing the slide deck that was shared by the panel with the membership. If at all you need to take a refresher.
Yes, and we are recording this session. We will be uploading it on KOA YouTube channel, and we'll be sharing the recording as well with the broader community.
Excellent.
Thank you again.
Thank you.
Thank you, everyone.
Bye-bye.
Thanks.
Thank you. Thank you.